It's one of the most frightening things you can witness as a pet owner. You walk into a room and find your dog or cat suddenly just unable to stand. They're stumbling around, their head is tilted way over to one side, their eyes are darting back and forth. It is absolutely terrifying. And, your mind immediately goes to the worst-case scenario.
And that's it, isn't it? That's the first question that pops into almost everyone's head. Is my pet having a stroke? It's a totally normal reaction, especially with how dramatic all the symptoms are. But here's the thing. While a stroke is technically possible, it's actually not a very common reason for what you're seeing.
What you're much more likely seeing with this intense head tilt and total loss of coordination is something called vestibular disease. It's a sudden problem with your pet's internal balance system, and while it looks just awful, the good news is it's often way less serious than a stroke. So let's break down what's really going on here.
So here's our game plan. We're going to walk through this whole scary experience step by step. We'll talk about what those symptoms actually mean, how your pet's balance system is supposed to work, how your vet will play detective to find the cause, what you can do at home to help, and, most importantly, what that road to recovery looks like.
Okay, first things first, let's just state the obvious. This is incredibly alarming to see. One minute your pet is totally normal, and the next, it's like their entire world has been flipped upside down. Literally.
The most important part of the sentence right here is that phrase, non-progressive. That's our first big clue that everything might be okay. It means that even though the symptoms hit hard and fast, they usually don't get any worse after the first day or two. And that's a huge difference from a lot of other neurological problems.
And these signs, they're the classic calling cards. That head tilt, the loss of balance, which vets call ataxia, the circling, and those really weird flicking eye movements called nystagmus. It's like their world is spinning, which is also why they feel nauseous and might vomit. It's like the worst case of seasickness you can imagine. All of these clues together point to a problem in one very specific system in the body.
So, to get what's gone wrong, we need to quickly look at the system that's designed to keep everything right side up in the first place. Just think of the vestibular system as your pet's own internal GPS. Or maybe a built-in gyroscope, like the ones in your phone that know which way is up. It's this amazing piece of equipment that's constantly working in the background, telling the brain where the body is in space. It's what lets your cat always land on its feet, or what lets your dog catch a frisbee without toppling over.
And it all begins right here, in the inner ear. You can see these little canals. Inside them, there's fluid and tiny, super sensitive hairs. When your pet moves their head, the fluid sloshes around and moves those hairs. And that's step one, detecting movement.
Then, all that movement information gets turned into an electrical signal. It travels down a nerve, which is kind of like a data cable, to a control center in the brain. The brain gets the message, processes it instantly, and sends out commands to the eyes and muscles to keep the body stable and balanced. So when this system gets scrambled, the brain gets garbage information, and the result is the extreme dizziness and vertigo we see. Okay, so if the signal from the ear to the brain is broken, the vet's first big job is to figure out where that break is happening. And this is where the real investigation begins. So the main question is this. Is the problem peripheral, meaning it's in the inner ear or the nerve, or is it central, meaning the problem is actually in the brain itself? A good vet can learn a lot just by watching your pet. For instance, with a peripheral problem, which is way more common, the pet is usually still bright and alert, just incredibly dizzy. If it's a central problem, they might seem out of it, or even show weakness in their legs. And figuring this out is key because it tells us how serious the situation might be. So what are the usual suspects? Well, by far, the most common one, especially in older dogs, is something called idiopathic vestibular disease. Idiopathic is just a fancy medical word that means we don't really know what causes it. It just happens. After that, a deep middle or inner ear infection is a really common cause. And then you have the less common, more serious brain issue. Your vet is going to follow a pretty logical path. They'll start with a detailed physical and neurological exam. They'll take a good look deep down in the ears. They'll likely run some blood tests to make sure nothing else is going on. And if they're worried about something deeper, like a hidden infection or a central brain problem, they might recommend something like a CT scan or an MRI to get a really clear picture. So whatever the cause turns out to be, your pet's world is spinning right now. They need your help to feel safe. And this is where you, as their owner, become absolutely crucial. Right now, your main job is to be their anchor. You need to set up a safe, padded nest for them, maybe in a small room or a penned-off area. Definitely block any stairs. They'll probably feel too sick to eat or drink, so you'll have to hand feed them and bring water right to their mouth. You may need to use a towel as a sling to help them get outside. Basically, you are their stability while their own internal sense of it is completely gone. All right, let's get to the good news, the road to recovery. Especially for that super common old dog idiopathic kind, the outcome is usually really, really good. This right here is the most hopeful thing I can tell you. For those idiopathic cases, those first 24 to 48 hours are the absolute worst of it. The storm hits hard and fast, no doubt. But it also tends to blow over pretty quickly. You can usually expect a pretty predictable recovery timeline. Within about 3 days, you should start to see them improve. Maybe they try to eat on their own, or they just seem a bit less wobbly. After a week to 10 days, their coordination is much better. And for many, by 2 or 3 weeks, they're pretty much back to their old selves. Now, sometimes they are left with a little souvenir from the whole ordeal, a permanent slight head tilt. But honestly, they adapt to it so well. It doesn't hurt them, it doesn't bother them, and they go on to live a completely full and happy life. It just adds a little extra character, you know?
Okay, and it's really important for us to say that all of this content is for educational purposes. It is absolutely not a substitute for seeing a professional.
If you are worried about your pet's health at all, or if they're showing any of these signs, the most important thing you can do is to call a certified veterinarian right away to figure out exactly what's going on.
It's really something, isn't it? What starts as a moment of pure panic can end up teaching you so much about resilience and about this incredible, invisible system that's working every single second to keep your pet connected to the world. It kind of makes you wonder, what other amazing things are happening inside that furry head of theirs?